We're going to be talking to Dr. Phoebe now, and in fact talking specifically about threads in general. There are, from my understanding, 3 different types we're going to talk about. So let's start with the ones that are probably a lot of people have seen. Lots and lots of tiny little ones. What are they called?
So they're the PDO mono threads. They originated in Korea, and they're really a skin treatment. They tighten and brighten the skin.
Whereabouts can we use those?
Everywhere.
So
anywhere on your face and body, anywhere.
So is it more for sagging or for...
It's not going to lift sag, but by tightening and giving the skin a little bit more thickness, it can have a bit of a lifting effect, but I wouldn't say that it's
more smoothing.
Yeah, it's more of a smoothing, firming sort of treatment.
Is there much of a downtime once we've had it done?
You can get bruising.
Okay.
Yeah, so you've got to allow a little bit of time for that.
Okay. Second type of threads we want to talk about. Now these are a similar concept to the monos, but are slightly larger, is that right?
Yeah, so they're also made from PDO, same substance, but they are manufactured differently. So they're long and sounds a bit violent, but they've got little barbs in them. And they're often used to lift the mid-face and the lower face. They also provide collagen stimulation, so thicken the skin, but also actually does have a lifting effect. So good for mild to moderate sag, can lift it by a few millimetres, and you're always better off for having done it. So always a little bit more lifted for having done it.
And the third type of thread, this one is, could I say it was a little more invasive as such?
Yeah, it's a little bit more intense. So this one it's called the elasticum thread. It's from Italy, and it's designed to give a bit more of a structural lift, whereas the other thread, the PDO, really just lifts the draping, the skin on the top. So they're actually nice to use in conjunction with each other. So the elasticum can lift the structure, and then the PDOs lift the drape, but the elasticums are a lot longer lasting. You can get at least 5 years out of them.
Can I use them all together? Is it something that you do as a bit of a mixture?
Yeah.
So depending on the shapes that you want to recreate or...
Yeah, they often go really well together actually.
Okay, so you can work out a plan for somebody?
Yes. Depending on your face structure and where you need the lift, often I combine them to give you the best result.